A very good morning to all of you. Myself, Dr. Rakesh Agrawal, Secretary General, Risk Management Association of India, and editor the Insurance Times Journal. Today, we have lots of friends from Bangladesh. We welcome them all. Our today's topic is healthcare and technology, the COVID-19 experience, and the way forward. Today's session is a joint initiative of Risk Management Association of India and Professional Advancement Bangladesh. The world becoming a global village has led to spread of pandemics very quickly, with COVID-19 being deadliest of all witnessed in our lifetime so far. Earlier also, pandemics have had significant social and economic cost to the humanity. The COVID-19 has seriously impacted the healthcare industry. No country in the world was prepared to handle pandemic of such a mass scale. Today, we have an expert panel to discuss and deliberate the future of healthcare delivery, use of technology, awareness for health insurance, fate of medical tourism, and steps we need to take to tide over these difficult times and learn to survive. Before I hand over the session to today's moderator, Professor Dr. Abhijit Chattoraj, I would like to briefly introduce him. Professor Chattoraj is a chartered insurer. He is the chairperson, PGDBM, Insurance Business Management, BIMTech. He is also the honorary vice president of Risk Management Association of India. Let me briefly introduce our organization, RMAI. RMAI was established in the year 1992, is an NGO engaged in promotion of risk management discipline and culture. RMAI has taken this onerous responsibility to create a platform for risk and insurance professionals, bankers, corporates to exchange resources relating to risk management, provide certification to members, and encourage research and development. This is a list of our governing council members. We have Professor Abhijit Chattoraj as our vice president, Mr. Sanjoy Kumar, who is an expert in risk management, Mr. KL Naik, who is an authority on reinsurance and has authored number of books. We have a advisory council member board where we have a lot of senior person from the industry. We have Mr. Kamalji Sahai, ex-MD and CEO Star Union, Mr. BD Banerjee, ex-CMD Oriental, Mr. G. Srinivasan, ex-CMD New India and current director National Insurance Academy, Pune, Mr. KK Mishra, ex-CMD Tata AIG. We also have a lot of industry experts from banking, corporate, general insurance, life insurance, who are assisting us in our promotion of activities. We also have a brand ambassador at Dammam, Saudi Arabia, Mr. Biabani. We organize a lot of activities relating to research on risk management, conducting workshops, seminars, research case studies, and offering courses on risk management and insurance. We have tied up with Chartered Insurance Institute London, AICP London, Risk Spotlight. BIMTech is our partner and it is very actively engaged in our activities. We also are tied up with Insurance. Last year, we organized a seminar on risk management in Mumbai, which was quite successful. And we had a participation of around more than 250 persons from the industry. We publish this quarterly bulletin of RMAI. And we have created a knowledge center at our portal, rmaindia.org, where we have linked to inspection reports, risk management resources, case studies, and all. So for more details, you can always visit our website for more information. Our today's session is a joint initiative of RMAI and Professional Advancement Bangladesh. Professional Advancement Bangladesh is one of the subsidiary of Green Delta Insurance Company Limited, established in 2014. It is one of the leading institutions educating the emerging insurance industry of Bangladesh. There are a lot of strategic partners of PABL. They are offering a lot of services. So now I'd like to hand over the session to Professor Chaturaj, who will moderate the session and take the things forward. Over to Chaturaj, sir.
Very good morning, viewers of this webinar from Bangladesh, India. It's a holy month of Ramadan, so Ramadan Mubarak to everyone tuning on this webinar. Thank you, Dr. Rakesh Agrawal, for the nice introduction. I have a very distinguished panel members today, and let me briefly introduce them. I have with me today Syed Almas Kabir, who is President of Bangladesh Association of Software and Information Services, which is known as BASIS, and is also Director of FBCCI. He is the Chief Executive Officer of Metronet Bangladesh Limited, the largest and most trusted nationwide communication company in the country, offering cloud computing, fintech, cybersecurity, intranet, internet, IP telephony, and other IT-enabled services. He has been associated with the ICT industry for the last 13 years. He studied electrical engineering at Jadavpur University, India, and did his master's degree from New York University, USA. He was attached to academia as associate professor at Independent University, Bangladesh for 13 years. He was also involved in various administrative roles in IUB, North South University, and City University. Mr. Kabir was also an adjunct faculty at National University of Northern University. He was elected as president of American Alumni Association and vice president of Bangladesh Malaysia Chamber of Commerce and Industry for 2 terms. Welcome, Mr. Kabir, for this webinar. I have with me Ms. Parjana Chaudhary, a very well-known and established name in Bangladesh, also in India. She is currently the Managing Director and Chief Executive Officer of Green Delta Insurance Company Limited. She has vast knowledge in microfinance, microinsurance, and SME banking due to her experience in leading roles in development sector as well as in SME banking. She is considered pioneer for developing microinsurance linked microfinance model developed for BRAC, as well as her successful leadership in establishing the largest SME banking network for a leading bank of the country. Ms. Chaudhary is the first and youngest female CEO in the insurance industry of Bangladesh and has been recognized by UN Global Compact as a local SDG pioneer in 2016 for women's economic security for her initiative through Nivedita, which is a comprehensive insurance scheme for women. In addition to being CII Goodwill Ambassador in Bangladesh, she is also board member of CSR Center in Bangladesh, Impact Chair, former president and of EO Bangladesh, member of International Insurance Society, executive member of Bangladesh Insurance Association, member of advisory board of BRAC Business School, and member of Bangladesh Board of Advisors of Asian University of Women. Welcome, Ms. Chaudhary, for this webinar. Looking forward to a very animated discussion later on. I have also with me a very eminent professor, Professor Rameen Sakoor, who is an MD and PhD. He is academic cardiologist who is son, husband, father, clinician, founder, and technologist at the Massachusetts Institute of Technology, Boston, USA. He is also the inaugural Janssen Fellow at the Koch for integrated science at larger labs, and his lab work on novel drugs for disease using systems biology, experimental cell and molecular biology, and developed stem cell and novel digital technologies for real world use. He did his undergraduate studies at the University of Cambridge, completing his clinical years at the Universities of Edinburgh and doing clinical training at the University of Oxford. He was a Churchill Fellow at Harvard Medical College and later the Mayo Clinic, and trained in cardiology in London. He did his PhD on stem cells and regeneration and AI at the University of Cambridge before moving to MIT. He is also the founder of a few medtech and AI companies, notably Sasto and Cambridge Hotware, which was fast company, world-changing idea, and most advanced innovation and best emerging technology in 2019. We have also with us today Mr. Joydeep Roy, a very well-known name and consultant in India. He is PwC Global Leader, Insurance Digital Assets, and PwC India Leader, Insurance Practices. Former founder and CEO of L&T General Insurance, and founder team of AIA Life and Tata AIG General. Joydeep Roy has 3 decades of experience behind him, comprising consumer goods, technology, banking, life insurance, general insurance, and consulting, along with board positions in several organizations. Welcome, Mr. Joydeep Chaudhary. Hopefully, we'll have a very, very animated session after some time. Let me briefly introduce the topic. Today, we are going to discuss about healthcare and technology, the COVID-19 way forward. Health, for a change, has all of a sudden become the most debated topic all over the world. And why not? Because of the simple reason, health matters to each one of us as an individual, as a society, and possibly as a country as a whole. Naturally, it lies at the heart of economic, politics, and almost all the activities. It is therefore not surprising that healthcare industry has been growing as one of the largest industry all over the world, including in Bangladesh and India. Healthcare in India is likely to become a $372 billion industry in India by 2023. And hospital alone will contribute significantly. It is expected that hospital will contribute to the tune of $132.84 billion in days to come. When I look at Bangladesh, in Bangladesh, the healthcare industry is growing faster than its GDP. There has been growing acknowledgement that high quality health services across the world should be effective, should be safe, and most importantly, should be people-centered. In addition to that, it should be very timely. When people require healthcare, it should reach them. It should be equitable, meaning everybody, irrespective of caste, creed, religion, sex, it should reach to everybody. And also, it should be integrated and efficient. Effectively, what it should mean? It means that it should be clinically appropriate and, in terms of cost, very, very affordable. The foundation of high quality health system revolves around its population, should also revolve around its population and the healthcare needs of the population. High quality health system, therefore, should be informed by 4 values. As I said in the beginning, people is very important. I also mentioned that it should be equitable. but it should be resilient, and of course, more importantly, it should be very, very efficient. What we are looking around all across the world, we are moving towards, as per the requirement of SDG, all the countries of the world have to move towards universal healthcare services. And in India, we started it with Ayushman Bharat in 2018. In Bangladesh, universal healthcare has not really started, but they are looking at it very vigorously. And I'm sure in days to come, Bangladesh will also go for universal health. Now, what exactly universal health tries for? It tries for meeting people's needs through comprehensive, promotive, proactive, preventive, curative, rehabilitative, and palliative care throughout the life course of an individual. The greatest problem today, what we are facing today because of COVID-19, is that COVID is resistant to current form of treatment. And at the same time, there is increasing prevalence of antimicrobial, which means that microorganisms such as bacteria, viruses, and other parasites change in ways that render medication used to cure the infections ineffective. As a result, what is happening? We do not have any medication at the moment to cure it. Therefore, the biggest question before us is, will technology be able to help? Will technology be able to help to find a solution for us in days to come? Something which we have to really, really look after. Ladies and gentlemen, let me remind you that AIs and robots are not, you don't only find them in scientific fictions. They are no longer figment of imagination. In fact, if I look at healthcare, they are likely to transfer healthcare very significantly in days to come. There was a time when we used to be fascinated by Isaac Asimov's I, Robot in 40s and 50s, and Bimax, the famous healthcare robot in Big Hero 6. And if you remember the famous character of Star Trek, Star Trek, where the doctor would have this, what in today's terminology we call them tricorder. He would hold a tricorder, which he believed, most of us believed also, that would cure anything, everything. It was very omnipotent device in his hand. Such tricorders will be there in plenty in days to come. What are we looking at? AI alone has the potential to redesign healthcare completely. Some of the ways AI is shaping the healthcare is by ways of robotic assisted surgery, timely detection and diagnosis, possibly improving the medical adherence, and potentially reducing the administrative work. What really has happened is that AI-led interventions, particularly in cancers-related diseases, has remarkably changed the landscape there. And if we look at, it has been able to reduce the false negative. False negative means where cancer is present but not spotted, which can become very, very deadly in days to come. Similarly, it has also reduced false positives. False positives can be very, very distressing. So AI has made very significant interventions in healthcare, and in particular deadly diseases like cancer. And if technology is used properly in days to come, life will be much easier, much better. I straight away start with Mr. Joydeep Roy. And my question to Joydeep Roy is that, Mr. Roy, the healthcare consists of hospitals, telemedicine, insurance, the medical devices and pathological instrument. All these constitute the healthcare, and technology impacts most of them. I wish that you set the context how technology can really play a big role to all constituents of healthcare in days to come. I wish that you just briefly set the tone and then I take forward from you.
Can't hear.
Can't hear.
You need to unmute.
Can you hear me?
Yeah, we can hear you.
Okay. Thank you, Dr. Chaturaj. And very happy to be here. Very important topic. I'm sure everybody is interested to get out of this COVID-19 situation, physically and mentally. I think we are all also mentally also to overcome by this. So it's an interesting discussion, and we are talking about healthcare technology, the way forward also. So in that situation, let me just delineate what each does. Healthcare consists of largely three things. One is people and talent, which is the entire medical fraternity, their ability, their development, their knowledge development, and the way they deliver. Secondly, the IP, the intellectual property, which comes out of research. And the third thing is about devices, medicines, and the logistics of care, which is to do with the hospitals and the devices and how do you deliver. So these are the three things where healthcare is divided into. So the other thing which if you have to think about is where does the money come from? That every country in the world, the healthcare money, the payer is divided into again three parts. One is individual out of pocket, paid for by insurance, and paid for by government. And we have seen wherever insurance pie is the largest and the government pie takes care of the below poverty line, the country develops. Therefore, technology has to be seen in this context. Technology otherwise has always been seen as reducing cost, increasing efficiency. But in this context, we have to see how it develops people and talent, how it brings services close to the customer, how it makes it easy and connect services across, and how new capabilities of proximity solutions, connected services, things like chronic, how to make care more than cure, how to get them also take care of the medical legal aspects instantly whenever some prescriptions is done, and the entire thing of IP development, also the logistics. So technology has to focus to make this dream happen, which is the people, talent, intellectual property, and the entire device logistics and delivery of care closer to the people, easy, and new capabilities developed. That would be the real way forward. And I wish and hope that this crisis of COVID accelerates the development and crunches our next 20 years development, which we always talk about next 20 years. I think we should not talk for next two years now. Over to you, Dr. Chaturaj.
Right, Ms. Joydev, yes, clinical effectiveness and cost effectiveness is very important. If technology comes with a high cost, it will not reach to the most of the people. Turning back to Professor Sakur, to begin with, can you share some real world experiences on how we are dealing with COVID demand and how technology sector is pivoting towards healthcare? Your thoughts, Professor Amin?
Thank you, Dr. Chaturaj, and thank you, panelists and people who are listening. It's a pleasure to be here. It's an odd time here in the United States. It's roughly 2 a.m. Boston time, so if I'm slurring in my speech, it's because I'm tired. So just wanted to give you a heads up. But it's a pleasure, and your comment is very interesting, and I wanted to just share with you just something that really is important in this section. I'm going to share with you and all the panelists a viewpoint that we had sort of given here. I just want to give everyone a welcome. A few disclaimers. Obviously, I'm the founder and chair of Cambridge Hardware and founder of another sort of health tech, but the views here are reflective of my experiences as a clinician, technologist, academic. I teach at MIT, and so I want to give you a perspective here. But there's always this point about risk, and if you look at risk and where technology is with risk in the perspective of where we view it is always in a positive light. Which is, if you don't take a risk, it's not worth living. If you don't play, you can't win. The whole concept of life is inherently risky. All of these proverbs about risk apply to ones that sort of have an optimistic view. What's interesting, though, none of that applies in healthcare. You cannot take that form of risk, and you cannot go ahead or go out on a limb, because it is almost a healthcare, a life and death scenario, or the well-being of a patient or a family or a loved one. And so I wanted to start with, we're talking about COVID-19, and I thought that's great, but I give you this picture because before we get down to batting and fielding in this whole topic, it's always good to know the actual ground that we're going to bat or ball on. And so let's do a quick pitch report of what exactly COVID-19 is. And because that is important to actually understand what the solutions are, where are the sort of technological points fit in. And I thought I wanted to just briefly envelop all panelists and to come in on this and to just basically start from scratch to say, what are we dealing with? What is COVID-19? We've been hearing about it. We sort of think we know about it. And then some people seem to know more than others. Some people know less. Whatever it is essentially a coronavirus, which is, in this case, it's called SARS-CoV-2, which we can, for the essence of the lay people and for Joes that are not medically trained, people call it novel coronavirus. It is novel, but coronaviruses have existed for millennia. There are types of viruses that cause disease in mammals like us, humans, and birds. And the main problem is that not all coronaviruses do cause problem in humans. It's just some of them are lethal. They usually cause respiratory infections, inflammations of heart, kidney. These are all the problems. But the reason I go back to this is we got to understand what we're dealing with and why COVID is a unique scenario. It's unique because we have had SARS, we've had MERS, which are sort of Middle Eastern respiratory syndrome, severe acute respiratory syndrome such as SARS, and COVID-19. These are the lethal varieties of coronaviruses. And genetic studies, whatever people have said, suggest that these are not man-made, but have come from transmission from bats. And we can talk about it another day about why bats in particular have harbored a lot of coronaviruses, but the spread is by droplets and close contact, and that's why this is a problem. And this is essentially what we're fighting with. It's not invisible, it's not visible to the human eye per se, but if you look down an electron microscope, for example, what you're seeing is this is what we're dealing with. This is actual coronavirus. This is the virus, which was courtesy from Southern California from colleagues who actually managed to show this. Now, the key difference that I want to stop here is to say, what is the difference between coronavirus, COVID-19 and flu? Is that unlike flu, COVID-19 symptoms are a bit unique. It's more non-specific. It causes a bit more dramatic clinical changes, whereby you have changes in smell and taste and sensation. But unlike flu, the incubation time for exposure to first symptoms for the flu is often 1 to 4 days, which is very short compared to the 1 to 14 or more days for COVID-19. Now, this is an important point that I would ask people to remember. So symptoms last longer for COVID-19, from 7 to 21 days, compared to a week or a couple of weeks for the flu. But the biggest play difference here is we do not have any treatment, as in vaccine for COVID-19, like the flu, and we don't know what we're dealing with, but there is hope that there are more sort of trials going through. Now, the implication something of this is, well, we have to do something till we get to grips with the biology to understand the clinical potentials of novel therapeutics. And so we are advising from a public health perspective, social distancing, wearing of masks. All of this has been shown to reduce the spread because, as I spoke earlier, the transmission is through spread of contact or through droplets. Now, key points are testing and reviewing and contact tracing all aids public health policy, but there's a little bit of detail here where how specific these tests are will dictate the potential to risk identify and show sensitivity and specificity to that test. But the key point here is until we come to grips with that, we don't know specifically if this is going to reoccur, in particular in the sort of the United States and Europe. We're not sure if this is seasonal or not. Now, the rationale for getting you to understand all of this in the beginning is that when you come to the holistic approaches of risk management, I'm sure others will sort of speak on this. There are a number of domains, 8 particular domains on this. What is interesting about, regardless of whichever domain you look at, technology has to play a part rather than be an entity on itself. And what we're discussing today is the potential for those are much greater than what we had thought of previously. And so ERM is not something that we just take for granted as in it prevents all risks. It's a program not to avoid all risks. It's an association and a design built into routine business processes. And it's a continuous process led by leadership onwards. And it's something that one should consider, because in the long run, what we're doing is, this is an example of what we're doing in my lab here in MIT. If you imagine the sort of schema on your left is the actual specter of the number of outputs that we are able to pick up, data points for individual biological changes in a normal person, as opposed to the right, these are the individual changes in one who has a disease. This is particularly difficult. And so your point, sir, going back to this is, how do you pick out what is specific? How do you know what will be risk amenable? It's too early to say. What, in answer to your question, technology should be able to do and is doing is to enable processes which are specific. In particular, if you look at AI, and I'll talk more on that later, it should be there to be assistive, right? I don't believe healthcare is a system whereby we can go for full pure diagnostic, because, you know, let's be honest, the intelligence of me and other panelists is much stronger than a computer at this moment, right? A computer cannot decide, yes, I'll start them on a ventilator, or no, Ramin, that looks like a heart attack. We'll put it. No one physically or actually will take that legal risk. And what technology now has to understand is, where do we come in as people, humans, and what, if anything, coronavirus is doing to us is to reassess some of the technological sprints that we have done, and to say, how well can we put humanistic real-world implications of that? And examples of that we have shown.
At the moment, I'll turn on to Mr. Kabir. He has some other engagement. So, Mr. Kabir, can you hear me?
Yes, Dr. Raj. I can hear you. Hello.
Hello, we
You
can't
can
hear
come
you,
live
Doctor.
also. If you can come live.
Well, my the camera is somehow not working.
Okay.
So I can. I'm
Okay.
not sure.
Fine. I'm sorry that you have some other engagement. But briefly, if I ask you, you have been in the technology for quality years, and how can technology be aligned with health insurance to deliver quality healthcare services in Bangladesh, or a country like Bangladesh or India? You have too many fragmented platforms working in Bangladesh. It calls for integrations if you really want to deliver quality healthcare services. And if you can share some thoughts on that quickly for the audience here.
Yeah. Thank you. Well, it is definitely true that for insurance companies to use the the healthcare database, we really need a centralized system. Unfortunately, that is not the case in Bangladesh, and like many other countries, they also do not have centralized databases. In Bangladesh, the the technology in healthcare management, it started about 10 years back, maybe a little more than 10 years back, with telemedicines. But at that time, it did not flourish because it was not it didn't become popular because the infrastructure was not robust. The internet availability or the mobile signals availability was not enough, and so it was not popular at that time. But in the last couple of years, we have seen quite a few startup companies who have started giving the telemedicine services, and also keeping records of the patients for their diagnostic blood reports or x-rays or MRIs like that. The only problem is, as I was saying, as you said also, that there is no centralized system, and government has been thinking about it. The government has plans. There have been several meetings with the ICT division, the ministry, and the health ministry about this. Well, we have been thinking of using a distributed system because, the biggest problem or biggest threat in the centralized system is the data privacy. Because if there is any leak, then it will be a very big problem. So the distributed systems are being designed. Actually, it is now in the design phase, and you probably the blockchain technology will be used. So that is the case, and once it is done, I really hope it gets done in the next couple of years. That is the target by 2024, actually. So if it is done, then I'm sure the healthcare insurance companies can take advantage of that centralized system. But then again, I actually want to reiterate about the data privacy issue. So that has to be addressed very, very carefully.
You have a very strong mobile coverage in almost all the 64 districts. And what I find also that the internet coverage is also almost 99%. With that kind of a digital backbone there, I have a feeling that Bangladesh can really do in promoting healthcare technologies in days to come.
Yes, definitely. We have the mobile coverage all over the country. The only problem is that, yes, the statistically, the internet coverage is also almost 99%, but most 95% of these internet connections are mobile based. They are not broadband connections. So the problem is the quality of the internet services. So as you know that if you want to use the technology maybe a remote surgery, or like virtual reality or augmented reality, like these high-end technologies, then you really need a very fast access to the internet. So until we can have the 5G, which is actually scheduled to be here by next year, and we have plans to start in 2021 and roll out all over the country by end of 2023, December 2023. That is the plan. If that happens, if 5G technology, 5G network is available, then we will see actually a boom and explosion in use of technology in healthcare. That, as I said, that can be like remote health. The doctors will be performing surgery or using VR or AR. I just want to mention here one thing, that one of the companies here in Bangladesh who are working with some US hospitals using Google Glasses, and that company, what they do is they whatever the doctors say in the hospitals in US and in some designated particular hospitals, they record those whatever the doctor says about the patient, and that information are transcribed here in Bangladesh, and those data are then retransmitted to the Google glasses that the doctors wear the next day when the doctor goes and sees the patient. So the doctor can see all the data on before in through the glasses. So this kind of technology is already here in Bangladesh. They are doing it for the hospitals in US, but I'm sure once the as I said, the robust infrastructure is there in place, we can start using that in Bangladesh as well.
Okay, that requires a lot of expenditure on technology and healthcare. One of the charges that people always put against technology is that it is not inclusive. It excludes many. So most of the healthcare benefits will go only to the richest. Possibly it will not reach to the poor and people who need healthcare most. Thank you, Mr. Kabir, for joining. I know you have some engagement. Would have loved you to have with us for the entire webinar session. Look forward to seeing you sometime again. Thank you. Thank you for joining.
Thank you.
Now, we'll turn to Ms. Farjana Chaudhary. Ma'am, you have been at the helm of affairs in insurance in Bangladesh for many years. Somehow I get the feeling that health insurance is not picking up as much as it has picked up in India. In India also, it has not reached to masses. The commercial health insurance has not reached to masses. But health insurance is in a very nascent stage in Bangladesh. And I know your company is doing great jobs to broad-based health insurance in days to come. Do you think technology can play a big role to popularize health insurance in rural areas or people who need healthcare most? Do you see what kind of role healthcare can play, technology can play in days to come?
Thank you, Dr. Abhijit. I think, and thank you once again for inviting me. And it was a fruitful discussion of the other speakers regarding, what are the healthcare technologies that have already come in Bangladesh. But in the insurance side, you see that, it's because of the awareness issue, people are not aware how insurance can benefit. But as you see, technology actually, enables us to kind of break all those barriers in terms of reaching to the client or giving them the health benefits and all. Because the other industries have gone forward. The insurance industry, unlike us and the other one or two companies, everyone is doing manual things. So technology can definitely will save time, costs, and also reduces the administrative processes. What Mr. Almas Kabir has mentioned that, and also Professor Ramin, that technology can help us reducing the time, giving the transparency. Like we are working in the weather-based indexed insurance product for the farmers, the remote area in the remote areas. There, with the we give a very low and discounted package where they can actually get the benefits without even talking to us or also getting any reports. The software triggers whether that if there is excess rainfall or excess temperature, the farmers will get proportional benefits. So this is actually it was done because of it was possible because of technology, because we're using satellite data, for analyzing all these aspects here. And the other one is like we're working on the SSK project where Shastri Shurakha Karmoshuchi of the Health Ministry. Their government is giving free health insurance, but we're the scheme operator, and what we do is getting the data. I mean, we don't have proper data in Bangladesh how many people are actually insured, although the people say that less than 1% is, the awareness. But I'm sure if you actually see the other, like the MRA, all the NGOs, they're also giving insurance services to their clients, which were actually was supposed to be given by a insurer. So there, to reach out to the last mile customer, they don't have to come to us. We go and get all their datas in a Palm Pilot, and then it's connected to the server. This is how we got like more than 650,000, families of family and people of the 3 remote areas into the system, and they get the health the health insurance services by having a biometric card. So in this way, we're getting more data, more experience, and they don't have to worry about getting the claim payment because it's all cashless. So this is this is also a pilot project. I feel that technology will not only help us in reducing the administrative services and bringing in transparency, and which will help the clients to get more, to have more confidence in the insurance sector, but also it will also create more avenues to work with the multi stakeholders. Like now, some companies, there are very a number of innovative startups who has brought all those information where through them we can reach out to the last mile customer, and these are the startup techs that we need to be working together. We have already started. We have few partners who actually help us, and our subsidiary GD Assist, it's also a member of BASIS, and there we are heavily investing in the IT structure so that we can help giving telemedicine service, video conferencing with the doctors, and with the help of mobile app, these are the ways they can also, technology can help us provide preventive measures, that will also give preventive measures in the long run. Having the medical records, by the having augmented reality or artificial intelligence, these are the areas that insurance companies must work together. But in this case, we are not getting any subsidy from the government because of the awareness issue of insurance. I mean, mostly other, like India and other countries, we've seen that these last mile customer segments, I mean, it works out because the government is supporting. So I think the way we've started revolutionizing the industry and bringing in the InsurTech concept and mobile app technology, and how to kind of actually understand the customer's behavior, and giving them the service whatever they're wishing for. Our issues are here because these has to be reinsured from abroad. And for that, the reinsurance pricing also is an issue where the farmers and the last mile customers in the health sector also, it's having the impact. So in this case, we really need to work out. Like for the COVID-19, since pandemic, we cannot cover. So we're drastically looking for a reinsurer who can give us this COVID-19 coverage. Because if we say that, okay, our health package has everything, but if we want to add this COVID-19 coverage, this will also take some time, because we don't know what is going to be the total impact, right? We don't know. Till now, we have like more than 8,700 people are affected, and the numbers is increasing. Or of course, there are instances where people are also getting bored. So, but at this stage, we are thinking that it should not be. It should not be the same scenario as we had it before. So we need to have coverage which can also help people to get benefits, and here multi-stakeholder approach is very much needed. And I think having the technology and the website and the app, that will also create and I think awareness among the last mile customers. And lastly, there are because those customers, I mean, they don't need so many information or so many features in the app. For the last mile customer, Bangladesh can also have started building, producing those very low cost mobile, and where only 2-3 features can be added. And this is the way, those farmers or the people who lives in the village or in this urban and semi-urban slums, they know. Like I can tell you, my driver, he doesn't know how to speak English, or he doesn't know English. But when I sent him some SMS, and he's using WhatsApp, and he understands. So it's like the phonetics. So this is something that we need to kind of come to the platform where a minimum orientation about technology is needed from school days. And the young generation, they're actually bringing in all those innovative approaches on the blockchain side, how blockchain can help bring in transparency and more I would say revenue for the insurers, and also for giving benefits to them. So this is kind of more of a holistic approach that we need to kind of take care of.
Right, ma'am. Now this is now time for us to take some questions from the viewers. I have one question coming from Sukesh Sethi. He says, insurers nowadays use predictive modeling to predict claims, which is completely based on historical data. COVID-19 is something new. How can health insurers make an idea of claims arising out of COVID? So, Joydeep Roy can chip in also here.
Sure.
And yes, I wish Dr. Shakur also joined and help. Yes. Yes.
Okay, just to explain for everybody, when predictive technologies are statistical tools and they do not really predict for one individual, they can come to an approximation, a stochastic range, saying that what is the probability that a certain individual may have a certain kind of a disease. But overall, predictive technologies give, it's an institutional tool which tells you about your entire portfolio. It might have certain concentration issues, saying that, okay, in this area, this profession, they are more highly susceptible to certain diseases. When it comes to claims have got two issues again. One is frequency, other is severity. Now, frequency is dependent on intrinsic principles of the human body, the susceptibility and the medical part of it, and also the care about it, because frequency depends on if somebody does not take care after discharge from hospital, can go get back again. So it's a complex subject, but it still can be controlled internally. Severity depends upon what hospital to what care you go for. There's a treatment cost, which is an escalation element. So it is quite as stochastic science. It can help insurers and portfolios in localities or as a whole, but it has limited use to predict it for an individual. In the case of COVID, it is yet another disruption, and it can be accounted for. COVID is just like any other epidemic which has happened. It's worldwide. We all seem very overawed with it, but if you look at it, it's statistically it is like any other epidemic with its infection rate and its fatality rate and mortality rate, which has to be calculated, but stochastically, not deterministically. Otherwise, it will give false results and false positives.
Okay. Another question which I want Professor Shakur to answer because of his AI expertise. This is coming from one Mr. Gautam Sinha Roy. He is asking, robotic surgery in certain diseases are already in place in many countries. What is your expectation that it will be available fully in Southeast Asia, which is Bangladesh and India?
So robotic surgery is available. It's actually available in certain diseases. For example, in prostatectomies for prostate cancer, there are available in centers, specifically, I believe, in Singapore, Malaysia, where you are using robotic surgery known as the Da Vinci device. So that is something is not so much from an AI perspective, that's actually from a training perspective. So that comes from the surgical training, which is coming from elite centers, tertiary centers, and that is something that doesn't really fully require infrastructure from an AI or IT perspective. It's actually coming from having the right sort of skill set from clinicians who have done post-fellowships in that surgical and intermissions with robotics as well. I would also add that robotic surgery is not purely in itself a unassisted process. There is a physician, there is a surgeon, and the back end of that is still not online in a purely routine manner. And so there are very good data to suggest that this is effective, but we don't have it, for example, in the United States or in Europe as the go-to at the moment. So I don't think it's a problem in Southeast Asia as is Southeast Asia lacking. It's more, it's actually the skill set of clinicians to actually take part in those specific robotic surgical interventions that requires a bit of a lag time. And it's always better to do that sort of training in specialist centers to get that experience.
Right. I have another question coming from Kenya with Mr. B.S. Sarma. He says that healthcare facility is fast becoming healthcare industry, and any emergency situation like COVID-19 gives opportunity to healthcare establishment to milch money and making it difficult for the common man to avail. Farjana ma'am, can you give your thoughts on it?
It's regarding the last mile, the poor people not getting the services. That's what.
Yes,
that's what you
because
said.
the healthcare system starts milching money, making money.
Actually, sometimes it's actually, the perception, the mindset. As you know,
Right.
that the concept of insurance is really vague in this country. No one really understands. And whoever comes for it, they think that insurance companies will be making money out of this. So but definitely, since I just mentioned that we are doing a pilot project with the health ministry, reaching out 500,000. Sorry for my voice. So this is how people are getting aware of it, that yes, we are getting this healthcare service. But the thing is that, like I mentioned, this is the way we are getting health information. We have health data with us. I mean, because it's been like 4 to 5 years, we have a huge database with us who actually comes into the healthcare platform. But the thing is, reaching to the poorest of the poor needs a different structure. They want, easy payout. They want very simple information giving to the insurance companies, but and they want to get the result. Because that's why the government has totally renovated the hospital in the community, where the world-class healthcare services are being provided. And people are, now getting aware. But the only problem in Bangladesh is we don't have, enough number of healthcare clinics. We need to have, because hospitals, it will take some time, right? So the big giants are big hospitals. But I can see that because the economy is actually going through a transition phase. You will see many poor people. They're also coming to get the best doctor. So. This is, I think, there are companies who are actually taking initiative to build hospitals or build clinics in the remote areas or in other places in Bangladesh. And what we were thinking, that there are a lot of diagnostic center every half a mile you have. And if we can kind of, with the help of the government, we can transform this diagnostic center a little bit of mini healthcare, so that people, when they're feeling, whether they have healthcare, health insurance tied up with that clinic or hospital, they can have those benefits, like cashless benefits, they can get those. So number of hospitals, it's a problem. That's why sometimes we see that the marginal people, they don't get all these all those benefits. But I think it's an individual responsibility for all the big corporates. They're they should be taking care of their community where they're coming from. So I think we can learn the Indian experience, how this, the agriculture, the Yojana project, it's going on, helping people. So, and having a very young population in this country, we need to, I mean, they're more, more aware than us. I mean, if you see that, I was in one of the competition, I was one of the judges in those blockchain and other competition. I've seen that they are coming up with these issues, how to reach out to the poor families, right? So technology and web app, this is the main thing that is actually, it's happening in Bangladesh, so how to get with the seamless data, and of course data protection, that's a different area. We need to kind of look into that, but partnering and having a bundled product like that really helps. Like our for instance, our Nivedita, the women product, that's a product for women from all walks of life. So we have separate products for separate segments. Like said, a lady living in a village, they don't need so many facilities what a corporate requires, right? So that's how the premium charges also goes down, and also the benefits that they require to help their family, it's taken care of. Only thing is we need to aware people what because the healthcare services, there are a lot of companies are actually now coming up with these initiatives. And I think when we launched this digital platform last year in the insurance industry, first time ever, now other companies are also following us. That's a good thing, that partnering with other insurance companies also will help us. And I think on the policymaker side also, ICT Ministry, Health Ministry, we need to actually work with them closely. Like still we don't have e-signature, e-stamping. So we need to have end-to-end process where we can give instant claim payment in one days or few hours time. So these are the things that that requires disruptive models.
Thank you, ma'am. I have one question for Professor Sapur. AI is your expertise, and it helps improve early detection and diagnosis. This is Google's DeepMind created an AI platform for breast cancer application. And what it has done is that it has helped in reducing the false negatives, which means where a cancer is present but not spotted, which can prove deadly, and also reduce false positives, which can be at times distressing. Tell us something, how AI can help people, help healthcare sector to reduce cost also and provide better healthcare access.
So from a real world example, I'll give you in two points, from a software and from an actual medtech, for example. So one of the companies that I founded, Cambridge Hardware, it is a medtech, med device manufacturer. It makes medical devices. In particular, in my field in cardiology, we never had any device that could give you real-time ECG, multi-lead, without leads, wirelessly charged, all of the things that you would expect a 21st century device to be portable, ergonomic, instead of what we currently have, which is like almost having an octopus stuck on your chest with individual leads. That's what we're dealing with at the moment. And so what we did, we had to go from the ground up. And what happens there is the AI, the main issue that people face in AI, and you gave an example of DeepMind, they come in from the software side. So they take the data, and then it's like saying, well, can you sift out specifics from the data? My point, and I think where AI should be going, and it's something that we're doing in Cambridge Hardware, is embedded AI intelligent devices, whereby this is agnostic from the software platform. Okay, so and what that means, IoT devices where are on the field, gives you that real-time diagnostic power of having AI chips now, where we have that transmission. And then what that means is what we're doing in terms of cost is to say the timing of that data from a viewing of a pathology. In our case, look at ECG. So the time it takes you to have a heart attack, to have irregular, dangerous heart rhythms, for you to then put on a device and then record it and then send it to the hospital and do all of that takes a couple of weeks. We're able to do that in 0.5 of a millisecond, where it doesn't matter where you are in the world, I can view that and assist and actually give diagnosis within that 0.5 millisecond timing. Now that has implications from real world, which is we are now looking at sort of going from East Coast to West Coast, from Japan to US to Bangladesh, India to London. What that means, the potential for patients is much greater, and that's a much more stronger B2C model. So before, you have to come to the ivory towers of hospitals, which are amazing institutions which house not just expertise of the doctors, but also have to house those devices. What I believe and what we're trying to do, especially in Cambridge Outwear, is to disrupt that whole model. And what that model means is I should not be in control of the devices. That devices should be available to you as a consumer, but these are medical devices whereby if you have that device, you now patch in your physicians or your cardiologists to then enable that assistive device to actually give you real-time data. Cost-wise, what does that mean? Cost-wise, it means that that transaction to go to the doctor, to have that consultation, to then have that device and then take it for 24, 48 hours and then give it back and then go back and get the results is done in a one-stop interaction. So you put on the device, you get the data, you're getting the data and said, okay, your doctor's seen that there's a problem, get off the device, come back to the hospital, we know what's happened. So that we have shortened what if you take that sort of scape of having a general practitioner see you to actually having a diagnosis, currently 3 to 4 weeks in the United Kingdom is now down to 24 hours. So the speed of that for AI is something. And in answer to your second point about software and AI, I want to go to something that a lot of viewers may not be aware of. We have talked about predictive AI. We have moved to the next generation of AI, which is actual deep neural networks and untrained data. What that means is I don't need the computer to have seen your data before. It uses that data in real time and using sort of Bayesian models, mathematical models, which are specific to you, not specific to different populations, specific to you. It then allows for discrepancies to then better understand. And the way we do that is if you fragment data, it means that that data doesn't have to be specific to one output. And so I go back to my point that the power of AI and what a lot of companies are doing like Google is to say, give me as much data as you like, okay? What is not clear and what needs more regulation is who gives them the right to give that data, and B, that is your data. So why are you not accessing that? And when you are getting these algorithms, is that allowed to be IPable? So these are ethical points, and from an AI perspective, it will be a lot cheaper, faster, and functional for you. But the question that you have to ask yourself is, where am I in that whole mechanism?
Thank you. One question I'm getting it from Syed Ahmed. He said, isn't it imperative for insurers to invest in healthcare technology innovations?
Sorry, can you repeat?
This is a question coming from Ahmed. Is it not imperative for health insurance company to invest in healthcare technology innovations?
Of course.
Yes, ma'am. Okay.
No, let him say first.
Okay. Any of you? Joydeep,
I can't hear.
Can you hear me now? Can you hear me now?
Yes.
Yeah, maybe. Yeah. It's taking a little lag after I press the unmute. Sorry for that. So I'm saying imperative is something which is imperative for an organization, be it insurance or anybody. I think it's time insurance companies everywhere, especially in developing countries, India, Bangladesh, everywhere, Southeast Asia, realize that it is an imperative, because not only does it enable bigger reach, make it more accessible, and increase their own business, it also makes their own business viable and more relevant to society. Because everywhere we have seen that more than the services, the technology innovations in telecom, in short tech, in mobile phones and everything has outpaced every other development. So it's a matter of time before these services reach the people. So if insurance companies do not jump on the bandwagon and support and really get into partnership with the insurtechs, well, there might be a new generation of companies which may not be called insurance companies, maybe called payer companies, which start becoming insurtech payers. So yes, it is
Yeah,
imperative
I
about that. Yes,
I
Your
fully echo with Joydeep, because that's why I mentioned that it's high time for all the companies to invest in technology. It actually it's really something that is prerequisite item for your company to survive, to help the clients. I mean, to get more clients in your company's database, and also to get them more benefits. It's transparent, it's easily accessible, hassle-free. So I think we're realizing it, and we feel proud to be have the first mover advantage in the digital platform last year. So I think this is absolutely impossible that we cannot go without technology. And one day, if we don't do anything, what will happen is our business will be taken over by all the startups. So I mean, it's kind of no one will know that, okay, this is the insurance company is giving the benefit service. The clients will know, okay, this is the platform or the IT platform, or there's some name they are giving. So I think
and they are
this is
giving with
something.
and they'll be giving insurance, and so in the
They'll
other
be
way
giving,
around.
of course, they are participating. They're
Yes.
I mean they're partnering with insurance companies. But the thing is, that actually gives their terms and benefits, not the insurance company coming in the front. So I think for that reason, we need to heavily invest in the insurtech, which is we have a lot of examples in the outside world that how it helps out. So I think all the stakeholders have to come to a point that where how much is needed from which company or which sector. So insurance companies has to come into the picture. Otherwise, people will be left out. Getting from getting the healthcare services from insurance companies.
There's one point I'd like to add on to, especially what Professor Shakur said. I like that point. This IoT is a kind of a developmental area which makes the technology invisible, or the statistician part of the technology invisible. I think that is here to stay. For long, insurance companies and healthcare companies have looked at each other as adversaries, because they have been looking at how can I reduce the cost of healthcare, and the healthcare companies look at why don't we pay, or why don't covering these. I think that has to come to a head now, and COVID-19 probably is a watershed time. And see, the iPhone did not come out because Apple thought of it. iPhone came because there was a right moment for screen technology, battery technology, and internet technology. Otherwise, iPhone couldn't have happened in 2007. Similarly, to 2020, let us say that now the governments and every company which is under stress, they need to think about how do we come together. And developments like IoT in devices and other technologies and data analytics, and the medical, legal, and the privacy issues notwithstanding, solutions can be found. But it only can be found if the insurance community and the healthcare community come together to support technology.
I want to give a perspective on that, because
one question that's coming from Kamalji Sahai, well-known insurance expert in India. He says COVID-19 has throws a challenge in respect of detection and isolation. So he wants the experts to talk on this, how to enlighten this issue. Professor Kapoor and Joydeep Roy, or any of them, ma'am can throw some light on it.
I mean, what I was saying is what ma'am had said, and Joydeep had said himself, is what's interesting. I'm going to be a bit controversial and say that insurance and insurtech needs to watch out, because what we're seeing now is big tech, especially in the US, for example. We have Amazon Care, right? So Amazon Care is essentially the tech side of Amazon, which are essentially bolting on physicians and now providing insurance straight to point. Now, that is an important point, which I think insurances are not really thinking about. And what I felt, I'm just speaking from someone who's tried to enable technology in globally, not just in the Western world. One of the questions that we get is when we try and go, and there's a company that we did called Shasto, which is essentially AI integrated. Now, when I go to India, when I go to Bangladesh, I did a tour and we went around and we went to Malaysia. The first question when you land is, I get this in Bangalore. I have this in Dhaka. So why do I need that? Now, that mindset cannot exist, because if you were existed, you would have done it. Okay. And I think there has to be a bit of pushback from what looks like big tech, because what we're trying to say is startup communities can be built anywhere. It's the handshake of the technology and the handshake of having, what does the customer really want? It's not what we think they want. It's what does the customer really want. Now, this is where startups are very good at, because when you have an unestablished or a very disruptive business, it is customer focused. Insurance, which is playing catch up, tries to go on to what it thinks are the sort of cherries on the cake, rather than enveloping and sort of saying, look, I want to have the cherry, but I also want to be part of the journey, because if I'm not part of the journey, then my whole establishment for actually providing support is no longer required. Because what the customer says is, I don't really need to know who other company is giving me that information or giving me that cover. I just want to speak to the doctor. I just want to see what the device shows. I want to see where that goes. So what's interesting about that is COVID-19 has pushed all of the insecurities, all of the problems in healthcare in societies straight to the front. It comes head on now, right? So if you cannot have healthcare at the point where you want to speak to a doctor, even though every hospital will, as soon as it says to you, you have COVID-19, please don't enter my establishment. So hospitals are doing that. Hospitals are scared to take COVID-19 patients. And you think your establishment is the point of care. If you do not take patients who have COVID-19, where will they go? Okay. Now, what startups and sort of tech companies have done is said, okay, this is great disruptive time for me. I would go directly. You can click on a button. I'll speak to the doctor. I'll bypass the hospital. Now, what InsurTech, and answer to your question, what COVID-19 is doing, and it's really taken up almost by 3,500% increase in telehealth in the United States. We have one of the highest rates prior to COVID-19 was 2% penetration. It's jumped up to 25% in the space of about 1 month. So telehealth will not go away. What telehealth has now said is, how quickly can my insurer catch up? Because the insurance is now saying, how do I even catch up with the B2C model, which is so quick? So in the United States, in UK, and all these other places, the main problem will be, how does insurers now try and bolt itself to say the relevance of insurance as the payer or the sort of auditor of this process? That's going to be an interesting point over the next few months post-COVID, because I can tell you now there's a lot of companies who are basically saying, well, if I'm the entity that's the B2C model, why do I need the hospital in between? Why do I need the clinic in between? So this is an important time, and it'll be a watershed time over the next few months. And going back to what Madam said is, I'm very interested to see that what they're doing is to partner with tech, which is disruptive. The more disruptive tech that you work with, some will work, some will not work. But at least if you put your feet in the ground with it, you will always have that journey much better. And your customers respect that.
Okay. Before we end up, the last question, what is the way forward? Where technology, health technology in particular, will take the insurance or healthcare industry with that? I love to have everybody's thought on it. So, you are muted.
I think Mr. Sahai's question got unanswered
Yeah,
on isolation and technology and things. So just maybe to add to that is that there are technology. Now, did we ever think that those infrared uh, thermometers will be on demand, such high demand? We did not. This crisis has brought it onto one of the top selling items. Now people are trying to buy it for their homes. So the question is, yes, isolation will be aided by technology. Already the government of India has the Arogya Setu app, which tells you if you're near someone and it alerts you if you're near someone. Organizations and corporates are putting through their own medical screening, proximity mapping, contact tracing, and behavioral things like how many people on a floor, how many people on a table or cafeteria. These are already been rolled out. Hundreds and hundreds of Indian companies, for example, have rolled this out as people get back into office. All those essential services which are running with 50% efficiency, and people are doing that. So it's not just things like hand sanitizer. As you go in, you're screened, your contact, your last night's history, and everything is tracked to make sure whether you are you are fit to be in the office or not, and your isolation or not is decided by the fact that you are near someone or not, including floor wise. So I think this is here to stay, and in some manner, not such a huge dystopian manner. The pendulum has swung from total chaos to massive amount of scrutiny. But yes, the data issue, the tracking issue, and everything will come swarming back in whenever we have some bit of normalcy coming in. And then I think that the system will find a new normal where certain bits of it of hygiene, tracing, isolation, ability in case of any other thing happening, any infection or any incident is here to stay, especially in corporate companies.
Yes, the last question that I was asking, what is the way forward? Just few thoughts, your small thoughts from all of you. Technology, all we can stand is going to play a very, very big and important role in days to come. What is important is to integrate them. But what about other actors of healthcare? How well they get integrated into the system, and then possibly what we are looking at is health, quality healthcare services. So this is where my last question is, what is the way forward post-COVID? One by one. Yes. Yes, Sajana,
Can I say?
ma'am.
As I said, that COVID actually opened our eyes, and everyone is exploring, and collecting the data, how many patients are being affected, and what can be done. And the health insurance, if we add COVID-19 as a coverage, there should be some area where the precautionary advices will be there, whether the client is washing hands or taking all those precautions when they're going out, because this restriction, if they take out, I don't think people will the normal situation will take some time to come. So I think in this case, insurance companies will have to be partnering with the startup techs, through which we can reach out to the people, and also giving all the information. And also there has to be a partnership with the hospitals and the diagnostic center. In terms of that, we're trying to kind of get a few hospitals, partnered with us, so that all the COVID patients can be, having this coverage. But recently, our government is actually paying for that. But this thing will be there for a long time. So I think it has to be a multi-stakeholder approach and a bundled product. Bundled product actually gives us the whole thing. The way we are working with Nivedita, we have a number of actors, like we have the telco, we have the banks, for access to finance, access to information, and also paying premiums through bKash or Nogod or other mobile financial services. So in that case, I think we need to get experiences from all sectors, all other multi-stakeholders, and then come up with a disruptive model, so that we can these type of phenomena, or this type of a pandemic situation where we can cover ourselves and also the clients, because all the new ideas, all the new experiences and solution will be coming. So solution can be worked out together. So that is can be my way forward.
Right, Professor Sakur. If health insurance has to succeed and survive, it has to come out with corollary health risk management. If that happens, possibly health insurance will survive. quick thought, and then I'll move on to Mr. Jaydeep.
Yeah, I think this is, I can honestly say that what you think is normal will not be normal anytime soon. There will be a new normal. And the question is, he who innovates the fastest and quickest will survive in this mess. And the second point to say, disruption will now no longer be regional specific. You will get non-specific regional disruption, which will be adopted very quickly and regardless of that. So the rationale for that is for InsurTech, be it in Switzerland, to the United States, to Dhaka, to Bangalore, it doesn't matter. If the tech is ready and if you can partner with that startup, regardless of where they are, let them solve that problem with you together. The main issue that InsurTech and what businesses in Southeast Asia have to rely on is before they were almost covered away from the process to say, well, this region is very different from the Middle East. This region is very different from the United States. This region is very different from Europe. Now, what COVID has done, it's a, you are all in the same boat together. It's not regional. And what's going to happen, you have to ride this together. And one of the points that I want to raise that we didn't talk about is what are going to be the main points, I believe, are going to be the points of the ethical and security viewpoints. And to really assist that moving forward, you will see in the next few months, especially when things sort of die down and we're sort of flattening the curves, there will be a lot more geopolitics in tech coming in. And that means we will be very much aware of who you partner with will have a long-lasting effect of who you do business with as well. And that, rightly or wrongly, means that the big tech companies coming to your door will be restricted by the fact that where the politics of this regional assistance is going on. And finally, one of the points that's often overlooked is, besides the geopolitics, there is a skills gap developing. And that skills gap developing in this sector has to mean that the institutions in countries which are not sort of R&D heavy or do not actually focus on postgraduate R&D and sort of the assistance of not just the technicians, but to actually inform them to go for higher level studies, PhDs onwards. That needs to happen, because otherwise you'll always play catch up where there's a brain drain going to institutions abroad, and they would quite happily set up and start up there. So to infiltrate that and cross-fertilize, that has to be a fertilization, not just from InsurTech, not just from businesses, has to come from government. And there's the final point is there is a lack of diversity and social mobility, which is often overlooked in Southeast Asia, which is what in disruptive tech in the West has been very good at. It really disrupts that whole cascade model of how we think about startup, how we look at the B2C model. And in the end, what I feel will happen, that COVID will actually allow a lot of people who you haven't heard of, but are now being taken for the same amazing ride together in larger corps, just because they have an aspect to the pie. So integration, social and ethical review of technology in conjunction with insurance, in conjunction with other companies, and the word collaboration. I don't hear that word much because in Southeast Asia, collaboration often means, did he come first? So first is a position. Collaboration is an output. So in COVID, you need output. It doesn't matter if you're first, you just need to think of the output.
Yes, when you talk about collaboration, for the first time in Indian market, we are seeing this. In fact, Indian health insurance market was more challenged by confrontation than collaboration. Before we sign up, Mr. Jaydeep Roy, I want to ask you, will technology help building preventive and wellness care to really say health insurance growing both in Bangladesh and India? What kind of role technology can play in preventive and wellness care? That's very important for health insurance to survive.
Yeah, your audio is mute.
Yeah, it is taking a little lag after I've press the mute button. Has it come on now? Yeah. So what's happening is that if you look at the entire population globally, everywhere in the world, COVID, without COVID, there is always a much larger proportion of people who are not in hospital. Only a few, few people in hospital, few who are chronic, and they sort of consume a lot of the hospital, the entire healthcare costs, and then people who keep getting into it in and out. But the largest chunk of people are the ones who are not there and who would like to not get into a hospital. And this is always a conflict where they think they do not need insurance. And how do then insurance companies make their economics run if they do not get the healthier people to come in? And the key to that is wellness. Key to that is giving value other than just a claim at a hospitalization. Yes, without technology, that cannot happen. Without personalization, hyper-personalization, technologies to provide people with services, advice, and things to keep healthy, it cannot happen. On collaboration and what is happening in Asia and globally, I mean, from my vantage point, I have a slightly different opinion than Professor Shaku here. I think there's last 4 years, there's been enormous amount of interest in insurance, especially in Asia, to get into health. All the large Asian companies have invested. They've tied up with disruptive providers of health and wellness advice, as well as IoT-based tracking of health. All of them. There's not a single one left out. Even in India, we have companies moving and for the last 1 year working on telemedicine, OPD health insurance policies, which are lying with various stages, either in development or with the regulator awaiting approval. And you will soon see a flurry of such which are coming with collaboration with technology providers or insurtech providers who are giving on-site remote diagnostics, remote prescriptions with insurance cover, with the ability to calculate the kind of claims which can arise out of this, including doctor advice and medicine. So there is a lot of activity. Now, this activity is a little chaotic, no doubt, but I will say the same thing. I think with the COVID thing, people will get doing it faster, better, and that will be as usual out of any crisis. Humanity should see a better tomorrow.
Right.
I would just like to add one point in this, the third-party administrator. In Bangladesh, we don't yet have this component, and any company who does that, and that is actually a very good platform where the screening is done, whether the payment was rightful or the hospital didn't do excess number of tests. So here, blockchain can also help in the ecosystem, and taking people in your organization from different sectors, that also helps. Like we have people from telcos, ICT background, health sector, agronomist, and we have a bunch of young generation and work with the university students. So actually what they want, how they want their products to be personalized, customized, So this is something that learning by doing things, you need to review. Like the OPD one, we have a pilot project in Mymensingh where we have really learning that how to kind of maintain this product so that and maintain transparency, because OPD is just like people don't know how many tests are being done, and the hospital also taking more tests because of their revenue. So in that case, there need to be tripartite agreement between the among the hospitals, insurance service provider, and the people or the organization where we are doing the health insurance. So it's a kind of I would say every day is a learning experience, and COVID will actually open the door for all the companies to take the advantage or the help of the technology to actually make the service more quicker, easier, and transparent.
So thank you, ladies and gentlemen. We are already 1 hour.
I think I will have a brief observation based on the discussions we had. The COVID-19 pandemic is putting a lot of strain in health systems worldwide. And the massive demand of health facilities and healthcare workers has led to health systems being overstretched and unable to cope with the pandemic. So in fact, our health system was not prepared to handle such pandemic. So we need to think how to prepare for this relapse and future pandemics, which may be more severe than this. So
Possibly
our health system needs to be
a topic for another whole webinar, isn't it?
Possibly. I always believe that we need to go back to preventive and primary care to
Yeah.
we have very vibrant primary care that can tackle many. So thankful, Ms. Farzana Chaudhary, Professor Satya
Thank you.
Ravi,
Thank you.
Professor Joy Roy,
Thank
Mr.
you.
Khattar for joining. I still can see close to 200 people, viewers watching this webinar. My profuse thank to Mr. Sayed Moinuddin Ahmed, with additional MD of Green Delta Insurance Company, also company secretary, who has really played an important role to organize this seminar. My thanks to Rakesh Agrawalji for really working so hard to ensure that we have very sizable viewers watching this. Thank you to all viewers from Kenya to Bangladesh to India and Dubai, from all parts of the world. Wonderful to have all of you here, and with the hope that the technology will redesign the healthcare landscape in days to come. With the hope that technology will emerge with a humanoid face, of which the benefits of technology really reaches to the poor and the marginal population, not so poor population who needs healthcare, whose healthcare needs are more. Thank you for this wonderful webinar.
Thank you.
Thank you.
Thank you.
Um,
Thanks,
Thank
everyone.
you.
Please stay safe.
Yeah,
Please stay
Dr.
safe.
Joining.
Yeah.
Everybody.
And
Thank
thanks
you.
all for participants.
Thank
We'll
you.
keep it. Thank you.
Thank you. Thank you. Thank you.
Thank you, Dr. Abhijit. Thank you, Dr. Agarwal.
Thank you. Quite life here in your country. Thank you. Thank you for
Great.
your wonderful. Thank you for your wonderful views.
No, thank you. It was great, and I hope it was very useful. And will there be a recording of this that we can share?
Yes, we'll be getting it. We'll be getting it. Thank
Super.
you. Thank you.
Thank you.
Thank you.